Biden administration last week announced agreements with major pharmaceutical companies to cut the costs that the government pays on selected prescription drugs used by millions of Americans. For more on the agreement, we welcome Dana Marie Kennedy, State Director of AARP Arizona. Good to see you. Thanks.
Thank you.
Yeah, we got a lot to talk about here. I want to start with this negotiation. This was a big deal, was it? I mean, they don't go into effect till when?
2026.
Okay, so we got a little bit of time here, but this is still a pretty big deal.
It is. So when they passed Medicare Modernization Act in the early 2000s, it basically didn't allow Medicare to negotiate. And so we had to work really hard to allow Medicare to negotiate. And that was kind of something what I view as like leftover business. Like AARP did support the Medicare Modernization Act. That was under the Bush administration. And we can't save money without being able to allow Medicare to negotiate. So this passed, in August, it was signed into law in August 2022.
Okay.
Under the Inflation Reduction Act.
And it involves 10 drugs to start off. Why these particular 10 medications?
So these were the top 10 medications that Medicare covers that cost the most money and also the most widely prescribed. So there are cancer drugs, there are diabetes medications, cancer drugs, and also drugs for people who have an autoimmune disease.
Yeah, I got blood thinners in here as well.
Right, yeah.
Okay, so
cardiovascular.
And again, they were chosen because they are most often used.
Yep. And cost the most money.
And they cost the most money. All right, it starts in 2026, you say. Will that list expand in the coming years?
It will. So each year it expands for 5 more medications. And so eventually it will be up to 50 medications. So there's always a delay. So once they negotiate, then it still takes a whole another year for that to take effect. So in 2027, it will be 15 drugs, 2028, 20 drugs. So it continues to go up 5 drugs each year.
We're talking about knocking down prices. How much will prices be knocked down?
So if it would have started this year, it's estimated it would have saved Medicare $6 billion.
Wow.
And it would have cost people who with their out-of-pocket spending about $1.6 billion. So that's substantial savings. Unfortunately, people won't see that savings until 2026.
When they do see that savings, is there a way for the average Medicare enrollee, what will that one person see as far as savings?
So it really depends on what medications they take. And so if they do take one of these medications, they could see substantial savings. So it's not only the out-of-pocket spending, but I think what's most important is this helps with the solvency of Medicare. So it actually brings the cost down as far as what we spend in Medicare dollars for Medicare Part D, which is the drug benefit. Eventually, it'll also allow Part B, which is the hospitalization. They'll also be able to have some savings there in the hospital medications as well.
I've read that it depends on what Medicare plan you're on. It depends if you have co-insurance. Work that equation out for me.
So all of these things are extremely complicated when you actually look at how much it's going to save you. And so every year Medicare has open enrollment, and you really need to decide what coverage is best for you. So I always tell people, like, do your research every single year during open enrollment. It's about to come up, and make sure that you're actually you're on the best plan possible, so you can actually switch plans just like your own health insurance, but it's really going to be dependent. And it does depend on if you have Medigap insurance and also if you are on a Medicare Advantage plan, which many people in Arizona are on a Medicare Advantage, where their Medicare Advantage plan is already helping with saving some of their costs. But if you have traditional Medicare and then you have Medigap, those are the people who are going to see the most savings.
Interesting. Holy smokes. You talk about complicated.
It's very complicated, and people have to do their homework. And I think it's really important to note that the Area Agency on Aging does have people who are volunteers to be able to help people. So during open enrollment, it's really important to go there.
I've heard critics say that this could drive up Medicare drug plan premiums, and that, yes, you get this, but you're also going to get that. Do they have a point?
So I don't know that that's necessarily valid. I think the same would be said with it's going to stifle research, and we already know that NIH covers research right now or helps spur research. So that's really important. The other thing that I think is really important is that in 2025, the out-of-pocket spending for Medicare is going to be capped at $2,000. So anybody who's spending like $10,000 a year in out-of-pocket costs, it'll be capped at $2,000.
I was going to ask you about that because...
Oh, sorry.
That's okay. You jumped the gun. That's great because 2026 is there, but next year, and that is a big deal too.
It really is a big deal. And the other thing that the Inflation Reduction Act did is it actually allows, like, so there's already a cap on people who are on diabetes medication. So it's already capped to $35. And also people who go and get vaccinations. Those vaccinations are free.
Yeah.
So there was some immediate benefit, but there's still some that we've had to wait patiently for. But 2025, I think, is where we're going to see the best savings for people out-of-pocket costs. But then 2026 is when Medicare really starts saving money.
Yeah, it's almost like Medicare is the patient in 2026.
It really is important because I look at solvency all the time,
Yes.
and when we added a drug benefit, it really shortened solvency, and so we really need to make sure that we bring those costs down because medical care is so much more expensive than it was, and so all those costs drive up Medicare costs, and prescriptions is such a big part of healthcare delivery, and many people take medications, and that's part of their healthcare plan. So it's really important that they actually take those medications to live a full, healthy life.
Yeah, and we got 30 seconds left here, but it would seem like Big Pharma would be happy with this because it expands their market. I mean, I know they're not happy about it, but it does expand their market, does it not?
Well, yes and no. I mean, it can expand their market as far as how many people are getting the medications. They always talk about it's actually going to rein in their cost. So it was negotiated, as far as how much they could charge, but they're already getting penalized if they charge more than the cost of inflation.
Yeah, I got you. All right, well, there's a lot to go through there, Dana. Thank
I know.
you for helping us figure it out. Good to see you again.
Thank you.